listening to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness. Your host is Dr. Emron, an experienced ER physician who has treated thousands of people just like you. Information on the show is not a substitute for professional medical advice. Always talk to your doctor or go to the nearest emergency room with any questions you may have.
Thank you so much for joining me today on Simple Health Radio. I'm your host, Dr. Emron. On today's episode, we will talk about a case that I had recently involving a child. The child was 9 years old, a healthy female, Caucasian, no medical history whatsoever, who presented to the emergency department with her mother. The mother described a situation at home. Basically, the 9-year-old child, we'll call her Mary. Mary was walking from the bedroom to the bathroom. The mother stopped her and asked where she was going, and the child began repeating words that did not make any sense. The child kept saying she was thirsty, over and over again. The mother thought she was joking and was going to get her a glass of water when all of a sudden Mary collapsed. Then Mary started having movements of her arms and legs in a very violent, shaking manner. The mother estimated that the entire episode lasted maybe 1 minute, and then after that, she was calm. Mary did wake up after a few minutes. She did not vomit. She had no fever. Nothing else seemed out of the ordinary. But when the mother asked Mary what happened, Mary really didn't know. This occurred at home, and the mother did not call 911, but she did call her pediatrician, and the pediatrician advised the mother to bring Mary into the emergency room. And that's when I saw her. It was about 2 hours after the incident had happened, and Mary was otherwise feeling fine. When I asked her questions about what occurred, Mary could only repeat what her mother had said several times in triage. She honestly did not know what happened. And at that point, I advised the mother that based on the description, Mary actually had a seizure. And that's what we're going to talk about today. Seizures are very, very common. They occur in otherwise perfectly healthy people, and they can affect people in very young ages, such as infants and toddlers, all the way up into adulthood. Now, in Mary's case, this was a first-time seizure, so this is called a new onset seizure, and that's why the mother didn't know what to do, and the child didn't know what to expect. The seizure itself is a disease or a disorder, but the other name is called epilepsy, and the difference is that seizures can occur randomly for different reasons. Epilepsy is a chronic condition, and that indicates seizures will happen over and over again. Now, since this was the first seizure episode for Mary, we did not label her as having epilepsy, but we had to do a full workup. So a workup in the emergency department for a first-time seizure is really trying to identify what may have caused it. So a seizure, in general, is what we consider a short circuit in the brain. Basically, there are too many electrical impulses occurring, and the neurons and the nerves that function in the brain become overloaded. The brain then sends out these signals to the rest of the body, and it causes several symptoms, which people may have seen on TV or in person, where the body shakes violently. There are actually different types of seizures, and there are several I can describe for you. Some are actually called absence seizures, also called petit mal. These are episodes where people are staring off into space during the seizure. They may not have any abnormal muscle movements at all, but during an absence seizure, people may be talking to that individual and they don't respond back. Sometimes people think they're doing it on purpose, when in fact the brain is so overloaded, the seizure activity causes this blank stare where nothing is processed, and that can last for a few seconds or even a few minutes before it goes away. Other seizures are considered partial, and then there are myoclonic as well as atonic. The difference is that with atonic seizures, these are called drop attacks. So, for example, if you lose all your muscle tone, people will collapse. Because if your legs and your back and the rest of your body are not coordinated, you'll simply fall to the ground. So atonic seizures are considered drop attacks. Think of it as fainting, but all of a sudden. The other ones are called generalized seizures, also called grand mal. And these are the seizures that people oftentimes have seen, which are very violent. So there are rapid movements forcefully of the arms and the legs. People may also have other symptoms involving the eyes or the lips or the face. And so it looks very scary to be in a room with someone who's having a grand mal seizure. Typically, these episodes will last for a few seconds or a few minutes, and then they disappear. And then the person is considered to be post-ictal. Post-ictal is the time frame immediately after a seizure. That's when people have amnesia. They don't remember what happened to them. They can't explain how they got where they got. They can't explain why they're on the floor, why they might be bleeding from their mouth. Maybe they bit their tongue or they bit their lip. They can't explain what happened. It's almost as though that period of time is gone and they will never know or be able to recall it. This is extremely scary if you're alone or if you're driving or if you're out in public in traffic. And so grand mal seizures, which are also the severe convulsions, partial seizures, atonic seizures, as well as the blank stare seizures, which we called absent seizures. Again, there are different types, but these are all related to the same problem. The brain is overloaded with too much electrical activity, and this results in seizure activity. If it happens over and over again, it's called epilepsy. Now, going back to Mary's case, again, she was completely healthy, 9-year-old child, had never had any problems. On the day that I saw her, she wasn't even feeling sick. She had no fever, she had not vomited, there were no new medications, no new foods, she had not traveled, but we still had to do a full workup. So in the emergency department, the workup involves focusing on the neurologic system as well as ruling out the other bad stuff, which could include infections, head injuries, or other unusual cases. Now, her neurologic exam was completely normal. Her eyes were normal. She was moving her arms and legs normally. She was smiling. She was able to walk and go to the restroom and come back. She had no neurologic deficits, so that was a good sign to start with. We did a CAT scan of the brain, which is a CT scan, that showed no abnormalities. She had no bleeding in the brain, no skull fracture, no evidence of any tumors. We did basic lab work on her, which included a CBC and a CMP. A CBC is a complete blood count that tells us a lot about anemia and any infections by measuring the white blood cells. The CMP measures a variety of chemicals in the body, including glucose, which would be for diabetes. It also measures the sodium and the potassium, which are vitamins, and it tells us a lot about the kidney function, which is the creatinine. All of her labs were normal. We did a urine sample on her, called a urinalysis, completely clean. There was no sign of any infection, no bleeding, no signs of any pus or any sugar. It was completely normal. So at that point, I did not have an answer as to why the seizure had occurred, and so I explained to the mother what the next best options would be. One option would be for her to be admitted to the hospital overnight to do additional testing called an EEG, which is an electroencephalogram. That's basically where stickers are hooked up to the brain, on the head in several areas, and then the brain waves are monitored. These can be done awake, or they can be done while they're asleep, and then they're interpreted by a neurologist. Now, the mother did not feel comfortable to admit her to the hospital since she was acting so well, and I did not force the issue, but I advised them that they do need to consult with their pediatrician and a neurologist in the office if she needs to have the EEG test done as an outpatient, because that may identify other types of activity. It can actually show you the brain waves that are abnormal during a seizure event, especially with some of those types that we talked about earlier. And the last question, which was actually the most difficult one to answer, would it happen again? And in her case, I can't say for sure. And what happens is, first attack of seizures, they are really challenging because if we find an answer, if we know it's because of a fever, if we know it's because of a medication, if we know it's because of an injury, then we have a direct one-to-one correlation. We know the cause, we know the effect, and then hopefully it will never occur again. In her case, we did not. And so I advised the mother that there is a 25% chance or a 1 out of 4 chance that she would have another seizure at some point in the future. Now, could that be in 1 week, 1 month, 1 year? It's hard to predict. And then the follow-up question was, well, does my child need medication? There are medications available for seizures and epilepsy, and those medications must be taken on a daily basis. There are some common names such as Keppra, Lamictal, Topamax, topiramate. These all work on the brain, and they help to suppress the activity or that electrical overload to reduce seizures in the future. However, there are some side effects with them. Some people feel sedated when they take them. Some medications may interfere with other medications, and these medications must be taken consistently in order to have the full effect. So in this situation, a first-time seizure in a healthy individual who had no warning signs, the guidelines tell us we do not have to start medication unless the patient has another seizure. So if that individual had multiple seizures in a certain amount of time, that patient has epilepsy, there's a very high risk they will continue to have seizures in the future. The only way to manage that will be with medication. Now, the other parts that we have to be aware of, people who have epilepsy have several restrictions. So these people, by law, cannot drive. Because if you have a seizure while driving a truck or a bus or your own vehicle, you may have a collision and you could hurt yourself or someone else, and that is life-threatening. So people who have a diagnosis of epilepsy and they are taking medication, oftentimes in most states, to my knowledge, they cannot legally drive. And that would be a very severely limiting factor, especially for a young teenager, a young adult, someone who has a family, who has a job. So those people, it can be a lifestyle change for them. Now, there are other causes of seizures that we haven't talked about, things like cancer, things that may be related to drugs and alcohol. And there are some theories about even the foods that we eat that could actually trigger seizures. And so there are special diets that may actually modify seizure activity. These are called ketogenic diets. In most cases, I recommend people, there are other causes, which may include cancer, tumors, old head injuries, old trauma, side effects from anesthesia, drugs, alcohol, even viruses, things like meningitis and variations of that. It's called encephalitis, can actually lead to seizures. Some people believe that certain diet and certain food may actually cause seizures, and so there is something called a ketogenic diet, which is advocated by certain specialists to reduce the risk of seizures in the future. I do hope that you found some important information about seizures and epilepsy in this talk. I will update my show notes and blog regarding it. If you or a family member have some experience with seizures and you would like to send us some questions or feedback, please connect with me online, and I'll be happy to discuss that on a future episode. And I thank you so much for joining me today.
We hope you enjoyed this week's episode. Visit simplehealthradio.com to read the blog, follow links mentioned on this episode, and easily share content with your family and friends. Subscribe to the show on iTunes, Spotify, YouTube, Spreaker, iHeartRadio, and the 3 and Out Radio Network. Be sure to connect with Dr. Emron on Twitter, Facebook, Instagram, Pinterest, and Tumblr to send us your questions and ideas.